All right, today we're talking about door traction for relief of low back pain. At our facility, we have commercial hinges. There's 3 of them, so they're quite strong, in which a person could hang easily on our doors and weigh over 200 pounds. However, in residential, we have to think that the hinges may not stand up if the patient is heavy, so we would simply suggest that you put some kind of wedge, like this is a wooden wedge, or you could put magazines under the door so that it would then be on the door itself. And then with that in place, we would then have the weight of the patient going right to the floor and not stressing the hinges. So the patient has low back pain. It could be local or it could be referring to the legs or leg. So we ask them to grab the towel that's at the top of the door with as high as grip as they can. And then their sternum touches the edge of the door. Their feet will remain flat at all times, and the toes are turned out in the letter V for Victoria. And then the feet then are split apart as she lowers her body, and the amount that she lowers is that amount where the arms begin to stretch. As she does this, then she would then reverse the direction and pull with her arms and assist with the legs as much as necessary. So the benefit of this is that if there's any load, in other words, vertical load of her body that is making the pain worse, such as with standing or sitting, then we try this to see if it gives them a relief and determine that if it does, we would use it as a pain management tool in that they would go down, they would feel the relief, and then use their arms to traction their body and come up. So this repetition of going up and down does not take that much arm strength, nor does it take that much leg strength. However, the person does have to have decent shoulders and no pathology in the shoulders. So that has to be cleared beforehand. There are certain situations in which the patient may have pain when they stand or walk, but their pain is immediately relieved when they sit. In those kinds of cases, you may try to do the traction, going down, the sternum's hitting the door, and then with a slight gluteal contraction, the pubic bone lifts in the front, and when the pubic bone tilts and lifts up, the patient may experience a relief with the traction done with what we would call a flexion bias in this position for the cases I just described. Then she would pull up and repeat the process. As far as dosage goes, the patient could do this once every hour or once every 2 to 3 hours, depending on how soon their symptoms are coming. We would like to think about them performing it before symptoms come on so that they're staying ahead of their pain and manage their symptoms with this mechanical remedy rather than chemical remedy of medications. Also, this is very beneficial for getting fluid to circulate because we have the arm muscles and the latissimus dorsi that comes and attaches down at the low back and then attaches to the front of the arm, then pulling the arm up so we have circulation of spinal muscles as well as a little bit coming from the legs. The pumping action also is good for the circulation of load and unload on the vertebral body and the disc.